Hi, I'm Dr. Joanne Fruth, Chief Medical Officer at Advanced Care. We are in a serious pandemic with nearly 4,000 people dying every day, but hope is on the way. We now have promising vaccines which are effective in preventing you from getting COVID-19. I'm here to explain how important it is for you to take the vaccine when it's available to you. In North Carolina, we say, you have a spot, take your shot. Your spot, your shot. COVID-19 is really contagious. You have a high risk of dying or having symptoms for weeks to months if you get infected. Let's consider some numbers. About 1 in 100 people who get COVID-19 die. That's 10 times more deadly than the flu. Every year, 40,000 to 60,000 people die of influenza. We are on track for 400,000 to 600,000 of our friends, colleagues, and family members dying from the virus, and that's with mask wearing and social distancing. Would coronavirus be 10 times more deadly if we weren't wearing masks? Could there be 4 to 6 million people dying? That's why it's important we do everything we can to stop this pandemic. That includes wearing a mask, keeping your 6-foot distance, washing your hands, and avoiding large gatherings outside of your pod. We all want to get our lives back to normal, to travel and enjoy our beautiful state and country, to hug our loved ones and to go to a movie theater or go to school safely. But now we have a new life-saving option, the COVID-19 vaccine. Right now, supplies are limited. There may be a spot to take your shot, but you have to be patient. Our state has designated 5 different priority groups to get your vaccine. Group 1, healthcare workers, and Group 2, individuals 65 and over are first. Then Group 3 are frontline essential workers like grocery store clerks. Group 4 are adults with high risk of exposure and increased risk for severe illness. And Group 5, everyone else who wants a vaccine. If you're worried about the safety of the vaccine, I want to assure you that it is safe. When I received my first dose of vaccine, it was a little emotional for me, but I wasn't afraid. The mRNA vaccine technology has been developed over decades. We have brilliant scientists to thank for this breakthrough. The side effects aren't too bad. Most people I've talked to barely knew they had taken the vaccine. Maybe there was some soreness in the arm, and they maybe felt fatigued for a day or so. The second shot comes with a little bit more aching and fatigue for about a day or two. I had a few more symptoms that most people talk about, but it was worth it. I'd like to tell you how the mRNA vaccines work so you'll feel more comfortable with it should this be the type of vaccine available to you. You have probably seen a picture of the coronavirus with the crown of spikes all around. The mRNA vaccines are different than most vaccines. Instead of introducing a deactivated protein or parts of a virus into your system to generate an antibody response, the small sequence of molecules called messenger RNA is injected. mRNA is a one-trick pony, so to speak. Its only trick is to instruct some of your cells to make that spike protein, which then causes your body to make antibodies. The messenger RNA is munched up by enzymes in the cell as soon as it does its thing. It doesn't hang around long enough to do anything because that's the only thing it knows to do, make the spike protein. It never even gets near your DNA, so it can't cause any mischief anywhere else in your body. Here's a few questions I often get asked about the vaccine. Do I still need to wear a mask if I get the vaccine? Yes. The studies which showed the effectiveness to be 95% were conducted under conditions where we were all wearing masks and social distancing. Also, we don't know if you can pass on the virus to someone else even though you've had the vaccine. Another question I hear is, if I've already been infected with COVID, do I need to take the vaccine? Well, first of all, I'm glad you did okay and you get to ask that question. But the answer is yes. The only time you should not get the vaccine is if you are sick from COVID-19. In that case, wait until you feel better to get your vaccine. The vaccine will be free and supplies are making their way to more and more people every day. And new vaccine types will be approved soon. When you have a chance, take your spot and get your shot. We want you to have a long and healthy life. Again, this is Dr. Joanne Fruth, Chief Medical Officer at Advanced Care.